podcast. Today's episode will be about the uterus. The uterus is an organ located in the pelvic area. The word uterus is Latin for womb. The uterus is a pear-shaped organ, and it is about the same size as a pear as well. Despite its small size, the uterus is an extremely powerful organ. The uterus is the organ that nourishes and carries a fetus during pregnancy. The uterus can expand from its original size to a size large enough to carry a full-term fetus. The uterus is strong enough to contract in order to push a baby out of the body. The uterus is split into three parts: the cervix, the body or corpus, and the fundus. The cervix is an organ all on its own and will be discussed in the next episode. The corpus of the uterus is the largest part of the uterus, and it is within the corpus that a fetus will develop during pregnancy. The walls of the corpus of the uterus are much thicker than those in the cervix or the fundus. This is because the corpus contains the muscles that are used to push the baby out of the body and the nutrient-rich lining that the zygote will use to develop. The walls are used to provide protection for the growing embryo. The fundus is also known as the top of the uterus. The fallopian tubes are connected to the uterus via the fundus. In addition to being split into three parts, the uterine walls themselves are made up of three different types of tissue. The first and outermost layer, the Myometrium, protects the uterus from friction by secreting a simple, watery serous fluid that is used for lubrication. Within the Myometrium is the Myometrium. The Myometrium contains layers of visceral muscle tissue. This tissue is used by the uterus to expand during pregnancy and contract during childbirth. Inside the Myometrium is the Endometrium. The endometrium borders the lumen of the uterus and is made up of columnar epithelial tissue. This, along with its vast amount of exocrine glands and highly connected vascular tissue, allows the endometrium to support an embryo or fetus while it develops. The musculature of the uterus is also split into three different layers. These include the stratum supravasculaire, which is the outer longitudinal layer that continues into the fallopian tubes. Next is the vascular layer, the stratum vasculaire, which contains many spiral-shaped interlocking muscles and a plethora of blood vessels. The last layer is an inner layer of muscles, which contain fibers layered longitudinally and obliquely. In addition to its complex structure, the uterus also has a key role in many of the processes of the female reproductive system. Pregnancy and menstruation are two of the most important processes that the uterus plays a role in. Before ovulation, the uterus builds up a layer of vascular endometrial tissue in order to support a fertilized zygote. If pregnancy does not occur during this time, the uterus will shed this lining, which will reduce to a pool of blood before exiting the body as menstruation every month. In the case that the ova is fertilized, the zygote will implant itself in the uterine wall and develop into an embryo and eventually a fetus. This will cause a variety of physical changes that will lead to the formation of the placenta, among other changes. The placenta is a temporary organ that is formed during pregnancy to link the fetus to the mother's circulatory system. It also secretes the key hormones that are needed to support the uterus to carry the pregnancy to full term. The placenta is shed soon after the delivery of the baby at childbirth. The uterus plays a key role in childbirth. Uterine contractions, along with a dilated cervix and a lubricated vagina, help to push the baby out. Please remember that pregnancy and childbirth are extremely complicated and unique aspects of human life, and that this is just a short summary of these two processes. Though the uterus is a hardy and crucial organ of the female reproductive system, it can also succumb to disease. We will take a 1-minute break before diving into some of the diseases of the uterus. Adenomyosis. Adenomyosis is a disease in which the endometrial lining grows into the muscles of the uterus. The cause of adenomyosis is unknown. Usually, it causes a symmetric, uniform increase in the size of the uterus, from the size of a pear to the size of a large orange. It may rarely cause a focal growth within the uterus known as an adenomyoma. Oftentimes, there may not be any symptoms of adenomyosis, but it is most common in women aged around 40 to 50 who have been pregnant at least once. The usual symptoms experienced by patients are heavy flow during periods with mild to severe abdominal cramps. The disease is often diagnosed by a medical professional while using an ultrasound or while performing a pelvic exam. Many women do not need treatment for this disease. However, medications such as ibuprofen and naproxen may help. Endometrial cancer. Endometrial cancer is caused by the abnormal division of cells in the endometrial layer of the uterus. These tumors are malignant and can spread and destroy surrounding cell tissue. The symptoms of endometrial cancer are abnormal bleeding pattern in menstruating women, or spotting and discharge, or any vaginal bleeding after menopause. The risk of endometrial cancer can be increased by smoking, being obese, late menopause, or starting your period younger than 12 years old. Endometrial cancer is typically diagnosed by performing a hysteroscopy or a vaginal ultrasound, among other methods. Remember, endometrial cancer can only be diagnosed by examining tissue from the uterus, so a Pap test will not detect endometrial cancer. There are a variety of ways by which endometrial cancer is treated, depending on the stage of the disease. Radiation, chemotherapy, and hormone therapy, apart from surgery, which is the mainstay of therapy, are all used to help treat endometrial cancer. Uterine polyps. Uterine polyps are growths arising from the uterine wall that extend into the lumen of the uterus. These are typically benign, but they may rarely turn into cancer. The polyps usually occur in women who are going through or have already completed menopause, but younger women can get them too. Uterine polyps are sensitive to estrogen circulation, so having high blood pressure, being obese, and being pre- or post-menopausal will increase the risk factors for uterine polyps. Uterine polyps are caused by the overgrowth of the endometrial cells, which is why they are often called endometrial polyps. A uterine polyp will attach itself to the uterus by either a large base or a thin stalk. Uterine polyps range in size from millimeters to golf ball size or larger. They often stay contained within the uterus. Sometimes, however, uterine polyps may slip through the cervix into the vagina. Some of the symptoms of uterine polyps include irregular menstrual bleeding, abnormally heavy menstrual periods, painful periods, infertility, and vaginal bleeding after menopause. If you experience any of these symptoms, please talk to your doctor. Retroversion of the uterus. Retroversion of the uterus is when the uterus tilts backwards instead of forwards. It does not usually cause any symptoms. Very rarely, it may cause mild or lower abdominal pain or discomfort. This is a very common condition. It is estimated that 1 out of every 5 women has a retroverted uterus. The condition, however, does not typically cause very many problems. However, retroversion itself may be caused by a growing uterine or ovarian tumor, salpingitis, or endometriosis. Which brings us to our next topic, endometriosis. Endometriosis is a condition in which the uterine lining, or the endometrium, grows outside the uterus. It can occur anywhere in the body, but often in the area around the uterus, for example, over the ovaries, the fallopian tubes, the bladder, the rectum, etc. The lining still thickens and sheds, but because it has nowhere to exit the body, it may form deposits over these surfaces. If it occurs in the ovary, which is by far the most common site of endometriosis, it forms cysts called endometriomas. It could disturb the normal tissue in the body as well, creating scar tissue and adhesions. The symptoms of endometriosis are often brushed aside as merely bad periods. However, they should be taken seriously. The symptoms include painful periods, painful intercourse, excessive bleeding, infertility, and bloating, fatigue, or nausea, especially during menstrual periods. The degree of pain may not be the best indicator of the severity of the disease, as women with acute endometriosis may have severe pain, and those with severe endometriosis may have little to no pain. Endometrial hyperplasia. Endometrial hyperplasia occurs when the endometrial lining becomes too thick. This condition may sometimes lead to cancer of the uterus. Some risk factors for endometrial hyperplasia are obesity, cigarette smoking, having a family history of uterine, ovarian, or colon cancer, and never having been pregnant. Some symptoms of this disease include bleeding after menopause, abnormally short or abnormally heavy and prolonged menstrual periods, or intermenstrual or irregular bleeding patterns. This disease is usually discovered through a transvaginal ultrasound or a hysteroscopy, among other diagnostic measures. In many cases, this condition can be treated with progestins in order to balance the excessive estrogenic activity which leads to hyperplasia. To conclude, the uterus is a critical and key organ in the female reproductive system. It plays a vital role in many of the processes of the female reproductive system. Though the uterus is susceptible to many diseases, as is any other organ of the body, a majority of these are preventable and can be treated and managed. Remember to talk to your doctor if you notice anything abnormal at all. Thank you for listening to the Euvie podcast. We will see you next time.